What to know about Adderall withdrawal and detox by Julia Rise, updated on May 26, 2024. Medically reviewed by Christy Reed, farmed. Fact-checked by Nick Blackmer. Fact-checked by Nick Blackmer. Nick Blackmer is a librarian fact-checker and researcher with more than 20 years of experience in consumer-facing health and wellness content. Health's fact-checking PRCSS. Some people who abruptly stop taking Adderall, dextroamphetamine, and amphetamine may experience withdrawal symptoms. Many people rely on Adderall to manage health conditions like attention deficit hyperactivity disorder, ADHD. Withdrawal symptoms of Adderall typically start a few days after discontinuing the drug and last 2 to 4 weeks. Withdrawal can cause depression, irritability, and sleep problems. 12. Since October 2022, the United States has been experiencing an Adderall and Adderall XR shortage, which has made the medication difficult to obtain. You may talk to a healthcare provider about alternative treatments, such as Focalin, dexmethylphenidate, and Vivint. Listed amphetamine. These drugs can also be in limited supply. It's worth considering non-stimulant interventions like behavioral support therapies. 5. It's important to consider withdrawal symptoms and how to comfortably manage a change in medication before going off Adderall. Read on to learn about Adderall withdrawal, including symptoms and how long it lasts. MACA and NACA/Getty Images. 7 symptoms of caffeine withdrawal and how to manage them. Adderall withdrawal symptoms. Anyone who uses Adderall is at risk for withdrawal when stopping the medication. However, people on higher doses or frequency or on long-term treatment are more likely to experience withdrawal symptoms. Withdrawal symptoms typically set in a few days after cutting the stimulant out, but this varies from person to person. Symptoms commonly include 1. Anxiety or depression, fatigue, increased hunger, irritability or agitation, sleep problems, trouble focusing. People who take Adderall for an energy boost or the sensation of euphoria tend to have the worst withdrawal symptoms and intense cravings, especially if they become psychologically dependent on the drug. 6 Withdrawal symptoms from Adderall usually are not life-threatening like those from alcohol or opioids can be. What is ADHD rebound? Some people may develop ADHD rebound after stopping Adderall. ADHD rebound typically causes the initial symptoms you had before taking the medication, but is more severe in intensity. 6 These symptoms can include hyperactivity, impulsivity, and inattentiveness. 7. Adderall withdrawal timeline. How long withdrawal symptoms last depends on the dosage and how long the person has been taking the medication. Symptoms generally last for 2 to 4 weeks. Some people may have symptoms that persist for weeks, especially if they were misusing the stimulant for a lengthy amount of time too. Here's what an Adderall withdrawal timeline may look like. Time SYMP to illness. Days 1 to 2 crash symptoms, such as depression and fatigue. Days 3 to 5 worsening depression, fatigue, and irritability. Days 6 to 7 mood changes and trouble socializing. Days 8 to 14 symptoms begin to gradually resolve. Causes. Adderall is made up of 2 stimulants, amphetamine and dextroamphetamine. These chemicals arouse the central nervous system and put it into a more alert, active state. 8. The drug boosts dopamine levels in people with ADHD, whose brains are constantly seeking stimulation. Some evidence suggests that this is possibly due, in part, to decreased dopamine activity in the brain. 9. This cause and effect relieves the brain's urge to seek out stimulation, physician Can MD, a psychiatrist based in Texas, told Health. Adderall will lead to an excess in dopamine levels in those who misuse the drug, triggering feelings of euphoria and wakefulness, and the brain can become dependent on the medication over time and rely on the high dopamine levels that it produces. This reliance causes the brain to naturally produce less dopamine. There will be a sudden absence of this feel-good chemical in the brain, causing withdrawal symptoms. Abruptly discontinuing Adderall can potentially lead to what's referred to as a crash in some people. 11. Treatment. No medication can cure the symptoms of withdrawal. According to Dr. Khan, some strategies can make the experience easier to tolerate, such as getting regular exercise, keeping a healthy diet, maintaining proper sleep, treating symptoms and GI issues. The majority of people will be able to ride out any withdrawal symptoms at home without serious health consequences. It's important to reach out to a healthcare provider if symptoms become intolerable or start to impact your daily functioning. This is especially important for those who experience worsening depression or develop suicidal ideation during their withdrawal. Managing and coping. You can talk to a healthcare provider about alternative ADHD treatments like Vivint, an amphetamine-based stimulant. Other options include Ritalin or concerted methylphenidate, and Focalin 4. Some of these medications are also in limited supply, so it may be worth asking a healthcare provider about non-stimulant treatments. Some FDA-approved options include Intunib, Guanfacine, and Strattera etamoxetine. For some medications, such as Wellbutrin, bupropion, can be prescribed off-label to treat hyperactivity and inattention 12. Several non-pharmaceutical interventions, such as behavioral support therapies, cognitive behavioral therapy, CBT, and biofeedback, can also help cloud treatments have different effects on different people. So it's important to talk to a healthcare provider about the full range of options and whether or not they'd be useful for you. Keep in mind that it's not worth buying Adderall from a secondhand source if you can't find it at a nearby pharmacy or through a certified prescriber. There have been accidental deaths and hospitalizations from counterfeit Adderall that's laced with fentanyl and other dangerous substances like methamphetamine 13. Looking for support?